Hey guys, I'm back with another great stock play. So, if you've never heard of this company, I actually didn't really know about this company until probably a couple days ago. We're talking about Adial Pharmaceuticals. And I know it's a pharma company. Maybe that sector is going to pop off, maybe it's not, but I think this is going to be a brilliant 60-day long play. And I'll tell you why. So, what is Adial Pharmaceuticals? Well, they're a clinical stage biopharmaceutical company focused on the development and treatments of addictions, primarily alcohol. If you have been paying attention in the pandemic, alcohol sales are through the roof because people are consuming to cope. Also, alcohol is probably one of the biggest problems in the United States and around the world, but mostly in the United States, with addiction and the impact that it has on not only family individuals, but on people not even using alcohol because of the bad decisions that addiction and alcohol can cause. Their primary focus is helping genetically predisposed individuals battle addiction, which affects about 35 million people per year. If you are looking at the news, if you've seen, we have a social problem with addiction in general to prescription drugs, but definitely alcohol. Sometimes you have the same problem. Maybe you're using both drugs and alcohol, but you have seen a huge increase in alcohol use and most likely alcohol addiction when this is all over. Adial might have a better solution. So, is this a real problem? Yes. Alcohol addiction is growing, especially with the pandemic. It costs the U.S. economy about $250 billion a year. And alcohol use disorder is going up, especially in younger adults. And younger adults will have these problems for longer in life. And younger adults are more likely to try and fix their own social problems versus maybe older people who may not want to deal with the stigma of addiction. So, are there already treatments? Absolutely. There is Antabuse, Vivitrol, Revia, and Camprol. You've probably heard of some of these before. Antabuse is the oldest of the drugs. It was actually came out in the 1950s, and it is a pretty brutal drug to have to take in order to stop addiction. Vivitrol, Revia, Camprol, they're all okay solutions, but they lack a certain part that Atriol does not. You do not have to be alcohol-free for 60 days, 20 days, 30 days, 10 days in order to take these drugs. These current treatments, you must have this abstinence from alcohol in order for the drugs to not hurt you and actually work. So all the negative side effects as well come from these drugs, including liver damage. Some people report having seizures, depression, which is going to lead to more use of addiction. And it's just not a great solution, especially for treating alcohol disorder. So what is Adial doing about it? Well, they have this product called ADO4. Number one, does not require abstinence prior to use. That's huge, right? It's hard enough to get somebody to go into treatment, but it's even harder for them to go cold turkey. So if ADO4, Adial's product, is going to be a vessel to get somebody into treatment without having to do the cold turkey, without having to do the immediate withdrawal symptoms, then their product is going to be highly effective. It's used along with gene mapping to curb your alcohol intake and reduce your consumption. So in theory, when somebody goes into treatment, they would be taking Adial and they would slowly be weaning off of the alcohol because they just simply don't have the craving for it anymore. Adial also has gene mapping abilities. They also have a COVID test involved in gene mapping that they had immediate approval for from the FDA, simple blood prick. And they are primarily trying to deal with people that are predisposed to alcohol addiction in the first place. And if we're talking about side effects, which is a huge deal, the side effects are similar to people with a placebo. So I'm not going to say no side effects. I don't think anything has zero side effects, but the side effects are minimal. We are focusing primarily on those certain genes that trigger alcohol addiction, and we are trying to take the stigma away from alcoholism. So this is going to allow for quicker, less threatening family and professional interventions, and you're not going to have that fear of a stigma. Now, Where are we in the process? Adial has completed phase 3 with some pretty phenomenal results. 66 of planned patient screening visits completed. 830 patients are screened out of 1,254 patients, and they're expected to be required to achieve full enrollment. More than 20 screened patients are currently pending enrollment. 32% of patients are screened are genetically positive for treatment for ADO4, so they qualify for this treatment. 75% of patients screened are genetically positive and have already been enrolled. 86% of onward patients have been retained, which means that this drug is doing really well in their trials. Adial is actually having a town hall today to discuss the positive updates regarding this drug, and they have been putting out press all over the place, trying to get some sort of buzz around it. Why? Well, Adial files for fast track on 2/23. They said, we are working with our regulatory counsel to prepare our fast track submission after consultation from the FDA. They had already filed for fast tracking to get to phase 3 back in September. So this is now another filing, and it's looking very good, commented Adial's CEO. Following our submission, the FDA is expected to review and request and make a decision within 60 days. So 60 days from February, March, April. We're looking at a late April, possibly boom for this stock. The FDA's fast track is a process designed to facilitate development and expedite the regulatory review of drugs that treat serious conditions that address unmet medical needs with the purpose of getting important drugs to patients earlier. This drug qualifies because of alcohol use, and the fast tracking purposes. Adial can make an immediate impact on a lot of people's lives. How does the chart look? Well, we're sitting between the 50 and the 20-day SMA right over here. Support seems to be at 232-ish. Resistance is definitely at $3. But we are up after hours, and for the most part, with the bloodbath of a week we had in the stock market, this stock has pretty much held up. It's gone up and down. It's had pretty decent volume. It has low short, and it is already made a double top. I think we're going to break out of that double top. The RSI is 47, so it's slightly overbought, but it's not totally overbought. So there is plenty of room to grow. What is your entry? Well, if you take a look at these charts, a good entry seems to be around a bounce off the 50-day SMA. Right now, that is 227. We're heading close to that right now at 250. I wouldn't get in right now. I would wait just to see how Monday is, possibly Tuesday, see if we get more volume, check on the news, see if there's a little more buzz. It seems like they are ramping up to get as much attention on this drug as possible, because hopefully in April, they're releasing this drug out to the masses. If you want any more stock tips, please subscribe to my channel, Trade With Me, and I hope you really enjoyed this video. Leave a comment below. What do you think about this drug? Do you think it has any potential? Leave me a comment. I promise I will answer, all right? Thank you so much. I'll be back tomorrow with another video. Have a wonderful day. Goodbye.